you're not a stroke center though.
Like, we're not a stroke center.
You're not a stroke
Yeah,
center.
but we have the capability. We have the capability of doing that.
But you don't have the capability of doing the intervention.
It's this.
We'll figure it out.
Figure it out.
We
You
have a
wanna do-
bottle of TPA.
Come on, you do it then.
So.
You have a
that's-
bottle of.
We're gonna get Sal in like one of those confession booths where he can tell you what's really going on. He can tell you
No, I
what's
mean,
happening.
and so like, it was the same thing with the STEMIs, right? We have hospital systems that, no matter what, wanna keep their STEMIs within their system.
Oh, when there's a
STEMIs are-
closer,
Right?
when there's a. God.
All right, we're ready to get started. Monica derailed us there for a minute.
I was doing your ECPR
Yeah.
thing.
All right. We'll call the March 28th, 2023 Board of Health, Force of Habit, different board, to order. I know Chief Arusa is not in attendance today, nor is Kyle, but I think other than that, we have a quorum. So, and Chris is via online, right? But he can hear us and speak if he needs to. That's the idea. All right. Is there a motion to approve the consent agenda consisting of the meeting memorandum minutes of December 7th?
Motion.
Got a motion? Is there a second?
Second.
All those in favor, please say aye.
Aye.
Motion carries. Moving on today, I don't know that we have a variety. We don't really have a lot of actual votes today, right? It's more of an update.
It's an update. I don't know if they need to be formal votes,
Okay.
but some updates on the grant process and some things. That we
Okay. Directionality. All right, go ahead, Monica.
Okay. So the first thing that we have, first person that we have up today, well, here's what I have on the agenda is we're going to talk about food protection. We're gonna just update you guys on our communications and marketing plan, our annual report, which I should be able to send out by the end of the day today, just for you guys to look at content. I'll just briefly talk about the board appointment timeline, and then just go through the contracts that we talked about at the last meeting. They're really ready. Just want to make sure you guys are aware of what those consist of. So first and foremost, I'm going to introduce Dan Stewart, our lead food inspector, who will be talking to you guys a little bit about what he does and his team. Woo-hoo. You can stand in front of this, or you can stand behind this,
I'll
wherever
stand
you're
behind here, and
comfortable.
if they throw anything, I can.
Dan's a rock star in the food safety
I know
world.
you
You
guys have been
pass
wanting
the-
to hear about food protection for a while,
Yeah.
and you will be really glad that we have a strong program.
Oh
Good,
man! Oh, these
good.
are the pictures.
Yeah.
Oh,
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 you gotta be kidding me.
oh.
You can go through those as we
chat.
take, and if you have any questions about those. Those are just some of the restaurants that we've had at Fisher's. We're very, very fortunate. We've got a high percentage of A grades in Fisher's, about 5 to 6% higher than what we would on average of restaurants, but we do have a few that fall below standards, and we've had to close a few. So just to introduce the team, Tim Burbidge on the top right has been with the City of Fishers for 16 years. He was with Code Enforcement before he came in to the Board of Health and the restaurant inspection team. Briggs Gonzalez, the gentleman on the top left, he's been with our team for about a year. He was a chef prior to coming on board with us, and so he's got some food service background. And then myself, I'm a part-time employee. I've been with the City of Fishers for 10 years. My background is about 40 years in the food business. I was a regional manager for a large corporation, and I dealt with anything in the southeast United States as far as food service. I dealt with them, and I dealt with a lot of high-end restaurant operators. And so the good part of that is it helped me and our team be able to communicate. And our job is 50% communication and teaching and educating the operators. It's not just going in and being regulators. So we're fortunate in the fact that when we started 3 years ago, we started with nothing. We were the Rodney Dangerfield of the food inspectors as far as the state, where we had no respect. I mean, literally nobody would sit with us at conference because we were such an outcast. But over the last 3 years, we've improved that greatly because so when we started the department, it was like, where do we go? What do we do? We just didn't know what we didn't know. So very fortunate that I was able to, at one of our first conferences we went to, learn about FDA standardization. And FDA has put forth a program for all food inspectors in the United States, and it's basically the foundation. It's how do you set up the department? What do you do? How do you train? What do you train for? And that it gives, here's your steps. So there are 9 standards that we go by, and it's regulatory foundation, and that is based on what are the food codes that we work on and what are the city codes that we work on. Training the regulatory staff. One of the things that we heard when we did inspections, that this inspector looked at this inspector did this one dinged us on this one didn't, this one came in and looked around, said, oh yeah, you're good, and walked out. We wanted to be consistent because we wanted the operators to know, here's what we're looking for. You know, these are the things that are important to keep food safe. So we trained our staff. We're in the process of training our staff that we have a certain number of training things that you have to go through to become a standardized food inspector. And myself and Tim Burbidge has completed that. Briggs is, who's the newest one, you have 18 months to complete. He'll probably have his done within his first 12 months. So real proud of him on that. The other thing is that we base our inspections on risk-based and HACCP programs. And what are the highest risks that are going to make somebody ill? So we look at that and how do you do the inspections and what do you look for? We're not looking particularly for the broken tile on the floor just because we want to ding them on something. We're looking at, are they cooking the food properly? Are they cooling it properly? Are they reheating it properly? And are they washing their hands properly? So the other thing I talked about was uniform inspections, really important with that. The other thing is foodborne illness and food defense preparedness, so we want to be prepared for that. Industry communication and relationship, and that is how do we react with the operators? How do we communicate with them? One of the things that we do that I'm really proud of is that the city office offers ServSafe training, and that's a certification that the restaurants can get for their managers to go through the training on food safety. And the city offers that at a reduced rate, and we have a lot of operators that are taking advantage of that. Program support and resources, and that's something that the mayor and the city council and you guys give us, is that do we have the right tools and the right equipment to do our job, and you do that, and I appreciate it. And then the last thing is program assessment. That goes back to, are you doing the things properly? What can you do better? Are you making a difference in the city for food safety? Are food safety violations going down, and are the complaints going down as far as somebody getting ill and so forth? So who we inspect? We would inspect, obviously, we do restaurants, grocery stores, mini marts, farmers markets, food trucks, and temporary events. So that would be like the farmer or the markets, or if somebody comes in, like if with the solar eclipse, if somebody comes in for like that and they're going to set up a tent, we're going to go and make sure that they're doing that safely. So we base our inspections on, like I said, risk level, and the FDA wants us to assign an operator, a restaurant, a grocery store based on risk, and it goes to risk level 4. And each one of those risk depends on how what are they doing? Are they cooking, reheating, and doing the things like that? The more you do that, the higher risk level you are. And that risk level means each one of those is, if it's a risk level 1, they get inspected once a year. If it's 2, we do 2, 3, obviously, and 4 is 4. So although we've got 300, right now we've actually got about 350 restaurants that we do. Out of that, we do a minimum of 2 inspections a year. Some of those we do 3 and 4 times a year that we do. We do average about 46 to 50 food trucks we do every year. 35 farmers market vendors. We do those multiple times. So just because they're here on one Saturday, that doesn't mean they only get one inspection. You'll see us walking around checking them multiple times throughout the year. Plus, like I said, we do the temporary ones like Sparks and things like that. So we do over 800 inspections normally in a year's period of time. The FDA guidelines is that an inspector shouldn't do more than 200. That's where they say the sweet spot is, because that way you can spend enough time in each one of the restaurants. Last year we had 338 A-graded restaurants, 26 B-graded restaurants, 15 C grades, and C's still passing. So before, if
So I
we,
always told my parents.
yeah, exactly. So when you look at that, it's, if in the past that restaurant would have been a pass, you would have not known that between a C or an A restaurant. And I applaud the mayor and the city council for having the courage to do that. And when we went through that transition, there was a lot of apprehension from the operators about it, because it's sort of going to be out there on what's going on. What we found with them is that the operators stepped their game up, gave them some real incentive to do better. Were asking us questions, how can we do better? Because it was affecting their bottom line. One operator was telling me it cost him from going from A to B about 10% of his income during that time. So it gave them some financial incentive to do that. So the next thing I had, just to show you what we're inspecting, I passed out some pictures that these are just some of the things that we see. The one on the far right, the cutting boards, when we look at those, that's something that they need to be replaced. You can clean those to a certain point, but after you cut with knives and stuff like that, the bacteria is going to stay inside. So we're going to tell them they've got to replace that. The one on the left there is some chicken. It's being thawed in the mop sink. I guess the good news you could say about that particular restaurant doesn't mop their floor very often.
I don't know if that's good.
It's not. Obviously,
sink is
when we saw that, we made them throw the chicken away. That restaurant did get closed down for a few days. Like I think I told you when we were sitting in there with the owner of the restaurant going over the violations that they had and what they needed to get fixed before they reopened. We were sitting there and mice were running across the dining room floor, just like one of them came up and said, "What are you doing here?" You know, it's sort of like that. But the first picture that you have on the top, or the one there, is just basically a stove. A lot of violations there, obviously because it's not clean, but the aluminum foil on there is a no-go either, because that could get into food, but just generally not very clean. If you look at the second one, what do you see there that might be a violation on there? That one, of course, because of the electricity, but there's also some little critters
Oh, yeah.
walking around on the electricity. And so in that area, there was a lot of those little friends that we don't want to see. On the third page, this page right here, the one on the left, that operator that's his grease trap that I've circled. He left the lid off the grease trap. He was taking the scoop that you saw there, putting it in a 5-gallon bucket and dumping it down the storm drain. He got closed down obviously as well. The other one on the right with the temperature that's just temperature abuse. And that's something that we really look for, is that if it's hot, it's supposed to be hot. It needs to be 135 degrees or more. If it's supposed to be cold, it's supposed to be
yogurt?
No, that's dressing.
So
Yeah.
either way.
Yeah,
You like-
it's supposed to be 41
Yeah,
degrees.
degrees.
And so we try to take pictures of when we do that so we can show them, and then that's got to go. So we go through and we check any food that's in prep areas, especially we checked at least 2 there in the cold area and 2 in the hot area. We go through and we check each one of their walk-in coolers and reach-in coolers to make sure that they're up to temp. And if not, then of course we have that conversation with them. This picture here, and some of them may be upside down. This is just underneath some equipment. And when you look at that, that's insulation that's on the floor. And that's usually caused by rats or mice. They'll get up into the walls and they'll pull that out and make nests. And then if you also look, there's some droppings on the side over there. So that's some other things. The next one we have is just an outlet above where they're making food prep. Obviously, those need to be kept clean as well. The one on the right, and I think it's upside down, that's just a meat grinder that they ground some meat, and if you look at it, it's just sitting there. Probably been there for 2 days. The meat was dried out. And it's also sitting on top of some rice, which is a no-no.
No-no.
So again, it goes back to, okay, there's a violation there, and we can cite them for these violations, but the main goal, the end goal of this is that they don't do it again. So we have to spend time that we go back in and work with them and try to educate them that this is not good, and why it's not good, and how to do it better. What can we do, work with them? So we're not just regulators. We go in and try to spend a lot of time with them teaching. This one is this is a pretty typical violation because everybody forgets about their can openers. They don't clean them properly. So they're taking that can opener and putting it in that can and opening it up, and it's probably got months of old dried food on it. The second one over there, if you look, is some more bugs. So that's things that we deal with when we see, and we try to help with those operators. But again, we're very, very fortunate in Fishers that our restaurants are really pretty good. We have a very high percentage of A's, so it gives us the time to work with the operators that are challenged to what can we do to help them. And so when we have a restaurant that fails or is a C, especially if they fail, we'll go back in every day to work with them, say, okay, here's what you're doing. Yep, we got that done. Let's move to here and move to there, do that, so that we can get them open as quickly as we can for them. We know that's a big cost to them. So that's sort of our goal. The last thing I had on here, what we're working for, is just one of the things that we're working to is that the state's going to have a new food code come out July or August, and I was assured August at the latest in our last conference call. But there's 485 regulations. I think about 15 of them are new regulations. Every one of them changed the code numbers. So there's a lot of confusion and stuff like that. We're going to have to spend a lot of time educating the operators. We're going to have to be prepared for it for ourselves because our software program has to be recalculated, and the point values to those have to be adjusted. I was fortunate that I was on the committee with the state to work with that, and so I had the codes ahead of time. So I've got that on the back page. So we're ready to go. We'll just give that into our software people and we can make our changes. But we got the point values changed. It goes from critical violations to non-critical. They're going to go priority. We're going to be the main worst ones. Priority foundations are things that could make somebody sick, and core. So then the values are going to, like I say, will have to be adjusted on that. The other things that we do with the operators is that we work on handouts for them that they can put up, and we do laminate them to hang up, and we do English on one side and Spanish on the other. We do try to get as many different languages that we can based on their needs, and then we offer things like temperature tracking that they can go through and make sure that their temperatures are in place. Do you have any questions?
Well, Dan, I appreciate your work on this. You've been steadfast building the program from the ground up, and I think you're leading the charge in Indiana, so thank you for that. To go from 0 to 100 miles an hour in a short period of time, it's greatly appreciated.
Well, thank you. We've been,
No longer Rodney Dangerfield.
no, we're not. We're not. We're being asked to be part of the state thing. So and that was our goal. Tim and I, when we were doing it, Briggs knew, but we were sitting there, so we don't want to be these guys.
Yeah.
We do not want to be these guys. We want to be at the front table, not the back table. And I think we've achieved that.
And I think compliment to you as well. I have not had a single complaint from a restaurant about your guys' approach to dealing with these issues. And that's not to say you're a pushover to the restaurant community, but I think it's a testament to your approach to education and trying to achieve an outcome.
We felt like if we're fair, and number one, if we're fair, and that we have that communication skill, that we're talking with them and listening to them, not just one way, and they know that we're there to help them, because we can show them that if they work with us and they make a restaurant cleaner and safer, they're going to keep their business. And we always approach it as that we want you here. We need you here. And if you keep your restaurant like this, you won't be, because your customers are just going to go away. And so they see the value in that. And we can prove it by restaurants that have went from a C to an A, and how proud they feel. And we have a celebration with them. When they get an A grade, it's not like, here's your grade. We have a celebration with them. So there's some.
Well, thank you for your efforts.
Thank you.
Okay.
We'll
Appreciate
work hard to bring you more restaurants.
Oh, you're
There you go.
doing that.
Yeah, it'll be a busy year for you.
Yes.
All right, Monica.
So hopefully you guys all see the value of having a city health department and having our own restaurant inspectors.
picture says
And
1,000
that they
dollars.
are
Ooh, I'm gonna
hard at work and doing the good deeds for the rest of us out in the community. So yeah, those pictures tell a big story. Before we go on, I do want to introduce, we do have a couple visitors today. We have 3 interns with us. So I think Allison and Gloria have been here previously. These are our high school interns from HSC High School. And then Jackson is a college intern. He's getting ready to graduate from IUPUI. And he was with us over the summer as well. He did water and pool inspections with Spencer, who you guys met last time. And now he's doing an analysis of the food grading rollout to see
Cool.
how the before and after outcomes look.
Welcome, guys.
If you want to talk to them after, you certainly can. But we're very happy to have them here. So at the last meeting, we talked about our RFP with a communications firm. So I just wanted to kind of update you guys. I knew that back then we had selected the firm. It's a firm called Plaid. They have sort of presented us with their plan. This is like a mock-up of a bag that they printed for us with the new logo and branding and things, and I'm using their PowerPoint template today that they created for us. They're focusing, starting April 1st, you'll see kind of new social media, so please follow us on social media and like it because that spreads word. And this is Briggs, our other health inspector. And then they've created a series of flyer templates for us. Their next act is kind of going through our newsletters and revamping those so there's consistency of branding and messaging. And then on the horizon, just looking to have more concerted calendars, deliberate outreach. Their proposal, they really got community surveys, they got stakeholder surveys, they put it all together, and we believe they really kind of hit what we were looking for in our voice. So, they kind of captured the tone of being accessible, trustworthy, community-centric, confident but approachable, and personable. So I think that's who we are. That's what we want to say about ourselves. We want the community. We want to build trust in the community, but we want them to be able to feel like they can talk to us. So hopefully you guys agree. If you want to see their full presentation, I'm happy to share it. But we're excited about what that will look like going forward, and if it will get some further reach.
It's a timely addition as we roll out our services that we're going to offer post-COVID. To be able to communicate effectively to our residents is important, so I'm glad to have them on board.
Yeah. Our annual report, this is the cover from last year, so they'll be kind of snazzing up our annual report, so I may have a different look than the last year one. Like I said, it's almost ready. I should send it out for circulation to you guys by the end of the day, so if you have feedback or typos or anything, you're not expected to proof it, but if there's anything that you wanted to see
Statutory
extra,
requirement for this board to approve that?
it is.
I know you have
Now,
to have
Chris can speak up. My understanding is it is not
Okay.
a statutory requirement. It is a requirement that we post it by
Okay.
some Tuesday in April, around April 10th.
Okay.
So that's our timeline goal to get it online.
Gotcha.
And then we'll bring it forth to you guys to just make an official approval if you like. But certainly if you have any comments before then, get it back to me soon. We'll get it up with your comments included. But some highlights of some of the, every time I go through these kind of year in reviews, I feel like when I start the process, I'm like, ugh, I just feel so bogged down in all the work there is to do, and I can't seem to get anything done. And then I do the year in review, and I'm like, holy cow, we did so much. I can't even believe how many things that we did. I mean, the retail food inspection grading system rolled out last year. We hired a culture of health ambassador to kind of move forward that vision for the city. We started our public health social worker program, which is a social worker and 3 community health advocates to connect our residents to resources and really try to build those systems to make sure that people are getting, everything that they need. We started our teen public health academy. We started mental health action teams in our mental health initiative, and those teams did lots of things with those. That's not even saying the long list of achievements that each of those teams had. And then we implemented our Credible Mind platform for mental health, which had over 7,000 users to the site between May and December. So, you know, I think it's near over 10,000 at this point. So really a lot of value. People are definitely taking notice, certainly of Dan's team, but the rest of our team. And we are being asked in those spaces. We're being consulted with by other health departments now to say, how do we do that? How do we look at what you guys did? We just presented on our Teen Public Health Academy and our internship programs to other health departments in Central Indiana last week, I think, to share on that. And we've been accepted to the National Association of City and County Health Officials Conference this summer to present on the Teen Health Academy and our mental health action team. So really exciting stuff, and I couldn't be more proud of the work that we've done. And I hope you guys are proud to be a part of this because we really appreciate your support in moving some of these things forward. So.
Could you, it's great information, Monica, I'm sure it'll be summarized well in the report. Could you send the board a snapshot data summary of the Credible Mind? Just kind of, I think it's interesting for this group to see after 7,000 or 10,000 what people are accessing, what are the typical questions people are seeking answers to, because I think it's pretty informative.
I'll just send the kind of canned report, which has all kinds of stuff in it. Absolutely. Yeah, it is really fascinating. And we get kind of aggregated data on how people answer the surveys. So, you know, and how we're comparing to like communities. So are we about as depressed or about as anxious as like communities? And the answer is we are. Like we match our comparable communities, and I don't know who they are, right? Yeah. But it's roughly equivalent, but we can track that over time, and the data points that we get back are really fascinating. But the resources that people are using in it are also fascinating. The report will show you which resources people are using. The resource people have most used, frankly, is our community resource list that we developed that goes to housing and food and transportation and all different kinds of kind of social need resources that we have used to augment for those needs. So.
One of the things that we talked about the other day, and I know we're going to get into in not our annual report, but our community needs assessment, is benchmarking against other communities that are actually what we would view as our peers. I don't think it's all that helpful to benchmark against the 3 other communities in Hamilton County because we're literally separated by a road. And really no one else in Indiana. Right. So we're trying to figure out who our peers are that we should be either aspiring to or truly are kind of our peers around the country, and I think those would be mainly affluent, educated, growing suburbs. Yeah. Olathe, Kansas, I think of Naperville, Illinois, Dublin, Ohio. Those are the types of places that I think it would be good if we could start pulling health data to say, okay, instead of looking at pounding our chest about how great we are in comparison to Indiana, let's start benchmarking against people that I think we could, try to compete against. So. Josh
our health outcomes are really the best in the state. It is not useful to compare compare to those. And Hamilton County is the healthiest county in the state already, but on most outcomes that makes us average for the country.
Yeah.
So
put us against Boulder, Colorado.
You want to start going up against the big boys, huh?
Yeah.
There's some other places.
Yeah. So we can do better. We can do better.
And I don't know. If you guys have examples of communities or population sets that would be, you always want to put a few reach goals in there or stretch goals. If you have any thoughts on that, we'd be welcome to hear what those are. I know Josh is going to start looking into that as well, because I really don't think it's productive to sit here and talk about how we compare to Lagodi, Indiana.
Right. I was going to say, we were just doing some work for the Indy Health District. Clearly the outcomes are a lot different, but there's some, to your point about what do you want to measure and what do you want to, we were looking at just that. Like, what is it we want to measure to see, is the Indy Health District going to do what we think it's going to do, especially if we're going to make this huge financial investment and there's a partnership. But they're working with the School of Public Health, the IU School of Public Health. The Fairbanks, sorry. I forgot the Fairbanks part. Yeah, and I forget who is doing it with us, but I can get you those. We've got metrics from, youth to, there's not very much built into that, but youth to adults, so.
It'd be interesting to see.
Yeah, there might be.
Yeah, nice.
Cool. All right, Monica, what else?
So just an update on the grant. So we talked about with the Health First Indiana money, setting aside $50,000 for community agencies that are working on core health services. So part of the Health First Indiana funds is, we're required to address core health services in a variety of ways and on a variety of topics that they've defined for us, what those core health services are. So we elected this year to kind of designate the community agencies that we felt would best meet some gaps in those areas and coincide with other projects that we're working on. So we currently have our contracts posted, as we're required to have the contracts posted for 30 days and have them kind of out to the agencies for review, but and then we'll bring them forth. Usually we send all contracts through the Board of Public Works for approval, so those will go out in the next month as part of that kind of 30-day process that we're required to do for the Health at First Indiana funds. But we've allocated or hope to be allocating $20,000 to Trinity Free Clinic to address access to care. They're the free clinic in Hamilton County. They offer a huge array of services. If you guys haven't been there, I strongly encourage you to visit or volunteer because it is amazing. I've never seen a free clinic like that. But really that they excel at connecting people into care, whether they have insurance or not. So they provide primary care services as well as specialty care services, dental and vision. So this is kind of a primary referral source for us as we see people with needs coming into our county. So that was why we designated them. Shepherd Center of Hamilton County works with elderly populations in a variety of ways. They offer mental health services, financial support, coordination of care, assistance with geriatricians, et cetera. They have a number of partnerships, but they're our number one partnership with our fall prevention program that we started. Because 20% of our EMS runs are fall related, so that's the first thing our community health advocates have really taken hold of is this fall prevention program that's getting going. We're using our EMS as a referral source, but also community agencies, and then they're the kind of a primary connecting point for individuals as they provide so many services to individuals in need, especially those who are older. So both access to care and trauma and injury prevention for Shepherd Center. And then finally, Breathe Easy of Hamilton County, which is administered by Good Samaritan Network. They do kind of tobacco prevention, cessation, and vaping education and a variety of services in that realm. So that is where we're hoping to allocate those resources, assuming that you all kind of agree with that plan and the contracts pass through the Board of Works.
I think philosophically, how we've approached this versus like sometimes the city does a grant application and it's wide open, anyone can apply, and then city council members will evaluate the merits of the particular nonprofit. I think what we did differently here, which I prefer, frankly, is what are we trying to accomplish? And I don't even view it as a grant so much as almost like an extension of service. So smoking cessation is something that is required by the state of Indiana for us to participate in. And so if these folks already have an infrastructure and ability to do it, then leverage that versus build it within.
Right.
And I think you could say the same about all
other
three
two.
of these is they're serving a service that I think if it wasn't present with them, we would probably be looking to somehow replicate it. It would cost more money. So I'm a fan of having not gone out because I could see people saying, well, how did these three get selected? And I think the point was we've tried to find people that are meeting specific needs for what we're trying to accomplish.
Yeah, and these three agencies clearly are. Now, when we get into next year, so the budget for the Health First Indiana funds for next year, which is a doubled amount approximately, is due to the State Department of Health by June 1st. So as we kind of head into that, probably the next board meeting, we'll want to discuss a little bit more about how we want to approach that, if we want to continue with that same path or approach it a little bit differently, but certainly a consideration for next year, especially with that increased funds.
Okay.
And then from a grants standpoint, we're offering small grants to school clubs. So this is using some of our school health money, which was really COVID money that converted into kind of school health support. And so our proposal, we're almost ready to launch it, is to allow for grants for student clubs that always have to have a faculty sponsor and have a separate account, right? So that the accounting makes it a little bit easier. But for student-led projects that have really anything to do with health, wellness, or service in the community. So a lot we've been hearing from teachers that, you know, sometimes they can't find the funds for club activities, and these are extra things for the teachers. They want to make it easy. The students have so many ideas, and we want to facilitate that as it relates to health and service. So we're getting that off the ground. So that would be up to $500 per year per club. If a club had a bigger idea and wanted to look more, we were surprised in the middle of the city council school board joint meeting 2 weeks ago. Jim Hallett, the owner of the Indy Fuel, surprised us by also offering a $10,000 grant to support this project and this program. So,
It's a nice
so we
surprise.
can then extend those grants with his support. So we're looking to figure out the best administrative path for that, but very generous gift. So I think we can confidently support those clubs. So we're excited about that. Any questions about this?
That's great.
Yeah. And then this is not really anything that needs to be done at this meeting. I just want to put it on your radars because I've gotten a couple of questions about board appointments. So we are approaching our 4th birthday as a health department. It comes up next month, April 24th. Happy birthday to us.
April 24th?
April 24th.
Yeah, for my birthday.
Happy birthday.
What you got for your birthday?
Yeah, I did.
Fisher Center
Yeah.
Department.
That was a heck of a
Heck of a birthday
present.
that
Yeah,
year, wasn't
yeah, Man,
2020.
I know how to celebrate.
That's right.
So some of our board members were appointed to 4-year terms, and so those terms don't end on April 24th. We really have until the end of the calendar year to reappoint or appoint someone new or anything like that. So it's just kind of on your radar that we don't need to worry about that at this meeting, given that we turn 4 next month. And the same goes for the health officer appointment, which would be Dr. Lane. So just putting it out there and putting it on everybody's radar so that you know that that's coming, since I had received a couple of questions.
Well, 4 years.
4 years.
That's crazy.
Happy birthday.
Can you believe
It's been a wild 4 years.
It has been a while, 4 years.
And if we summarize all the highlights from those 4
Oh,
years,
man,
just
the
think how long the
lowlights.
list
The
would be.
highlights
and lowlights.
as
It
well.
It'd be so long.
Yes, it would. Yes, it would. Anything else?
I don't have anything else.
There's something else I was going to cover. Oh, you might have heard Chief Arusa is announced his retirement at the end of the year, right around the end of the year. But he's expressed a desire to stay on as a board member. He's on the beach in St. John right now, so
Oh, rough.
Yeah.
St. John's a great.
I know, I love it.
Oh, I love
I'm
St.
jealous.
John's. St. John's.
So he's living his best life at the moment.
You might deserve it.
Clinic operations, I just want to give a quick update there. I really appreciate, we brought on for lack of a better term, chief financial officer for the public health department. And she's been at Board of Works every meeting we've had with another insurance company that we've gotten certified that we can now bill. So that's been quite an ordeal. But I think we have 6 or 7 insurance departments or insurance companies now that are
That we're credentialed.
We're credentialed with.
Yeah.
Humana came in maybe 2 days ago, United Healthcare.
Anthem?
Anthem we've
Oh,
done,
okay.
yeah.
Medicare, Medicaid, all the
Oh, super.
managed care, and Community Direct also, so all of the community employees and Fisher's employees.
So I think probably you can anticipate
Nice.
at our next meeting, and I don't
Yeah.
want to put pressure on Monica here because we haven't talked about it, but I think at our next meeting, probably a more robust discussion on where clinic operations go from here, because we've been kind of heads down on the more administrative back-end infrastructure side of it before we could talk about, okay, what services are we going to expand into, and what does that look like, and what does that model look like? I think probably at our next meeting would be an appropriate time to have more of a deep dive into, okay, now we're ready to expand services, and what does that look like? Is that fair? And that's where I'll lean on all of you, because I have no idea what I'm talking about when it comes to those services. But I think we have a general idea of kind of where we want to go with that, right? So, but I've been really impressed with our CFO going through all that work with all the insurance companies, and everyone has a different process, and it's a lot. It's a lot.
It is.
And we do have a billing system now, our software program.
Yeah, so our EMR is able to, as an add-on service,
Bill.
they can process the billing, so they're assisting with the credentialing, and the contracting
said are we 84% insured? Is that what I saw yesterday in the stats?
No, I mean, when you look at all insurance
Probably.
coverage, it's closer to 97%.
So it's pretty, I mean, it's pretty relevant for us
So,
to.
and that's why we're putting a
Yeah.
lot of effort into making sure we capture
Yeah.
as many insurances as possible because we're a highly insured community. So
Well, and I
it just
assume
makes sense
you
for
went after the
this.
big ones first, right? Like who are most of us insured with, like that?
Yeah.
Or with the big,
The top
Pulled out
three.
the information from our HR to look at whether most
look who's got,
policies,
yeah.
Yeah.
insurance forms
Anthem
accepted.
is a big, probably big.
Well, COVID,
Anthem's the biggest.
Yeah,
COVID was a
it's the
pretty
biggest in
good
the state.
exercise in that. I mean, COVID
Yeah.
provided us
Yeah.
a good baseline of
Right,
where
for what-
most people insure that.
120,000 people, yes.
120, that's a good sample size.
It's a pretty good sample
For
size.
private insurance only, it's about 85% covered. When you add in the public mix,
Yeah.
the total population is right around 97% covered through insurance.
That's
A
impressive.
little different than your health district.
Slightly.
Yeah.
85% commercial insured is
Yeah,
like,
yeah, right.
I'm like, what?
Yeah.
I'm like, what did you just say?
All right, well, if we don't have anything else, I will make is there a motion to adjourn?
Motion.
Motion's there a second?
Second.
All those in favor, please say aye.
Aye.
Meeting adjourned, thanks.